Hello again. We're going to look now at social planning and look at planning in the humanitarian context and emergency community work. Social planning, and I'm looking at slide 16 on the PowerPoint. Social planning is usually in response to an issue that's in the public arena, and there are probably a number of examples that you know of where this has occurred as well, and a couple that I'm going to mention are the Royal Commission into Institutional Responses to Child Sexual Abuse in Australia. This is an Australia-wide Royal Commission that has been initiated by the federal government, and it came about as a result of much lobbying and awareness raising and concerns discussed through the media, through some very active journalists in New South Wales, through people who had set up support groups who had experienced abuse in the care of churches or religious orders, and community members raising the awareness and talking about this issue that for decades had completely gone without any justice being delivered to people who were victims. Many of the people who were victims of child sexual abuse in institutions are now adults, but sadly this issue remains today. So the Royal Commission into Institutional Responses to Child Sexual Abuse is looking at that issue of how children, when they're in the care or under the responsibility of some kind of institution, have not been protected and have not been safe. This Royal Commission is currently happening all around Australia. The way that they're conducting that Royal Commission is by holding public hearings. It employs commissioners, it employs counsellors, it employs legal representatives, it employs support workers, cultural advisors. Many hundreds of people are employed for this Royal Commission to operate. At the end of the hearings and at the end of this Royal Commission, there are reports, there are recommendations, and there are also outcomes that are expected even now to make a difference to how institutions operate and to how institutions care for children or respond to people who come forward and say they've actually experienced child sexual abuse. And I encourage you to have a look at the website if you want to find out more about that Royal Commission. But it's important for you to know that that fits as one example of social planning, that as a result of an issue that's in the public arena, there's been needs assessment, or the research that's been done is being conducted by the federal government, and the way that the needs are going to be addressed is through the reports that will come out of the recommendations that come out of that Royal Commission, and then evaluation research is undertaken. Another example of similarly an issue that has come to the awareness of the public is in Dondale Youth Detention Centre in Northern Territory in Darwin. This featured on ABC News, ABC television last year, and as a result of that, information publicly being shared about how children were being abused in a detention centre in Northern Territory, another Royal Commission was set up, and that Royal Commission was looking at the protection and the detention of children in the Northern Territory. So another Royal Commission, but a very specific focus that actually looks at what's gone wrong when children who need support and who are in trouble have been hurt and abused while they're in the care of an institution, a detention institution. There are many examples of social planning. Another example would be the Northern Territory emergency response, when the federal government suspended the Discrimination Act so that they could actually intervene and send people, including police, into Aboriginal communities in the Northern Territory. It's worth thinking about when these particular examples that we're talking about, social planning, they're probably significant demonstrations of, on a big scale, how social planning might actually look. However, on other levels, there are many, many smaller examples of social planning, and another one of those might be young children who grow up living in a care system, or some people still call it wards of the state, where because of their family's circumstances they no longer live at home and they are provided with care in a foster family situation or in a residential care situation. These children, when they turn 18, usually they leave home. And in the instance of these children who've been under the care of the state, they have significant needs around housing and education and employment. I was involved in a process where we interviewed and spoke to a number of these children in Victoria and asked them questions about what did they need to have, what supports did they need, and what was life like for them when they left care, and what did they need. The result of that interviewing and writing of a report for the needs of young children leaving care influenced how government saw the needs of children in this situation, how government saw that they needed to make a commitment to continue to provide some funding and support for these young people to have ongoing assistance to get housing, that they needed assistance with education or getting work, and that they needed some ongoing support as well. So as a result of that exercise, influence was made on government policy and funding towards those young people. Let's just go back and look at what some indicators of good planning are. This is really for you to think about from your reading, to think about what do you know might be happening in a good planning process. What might be some of the barriers to good planning? And let's go back to the context, the community work context. What might be some of the challenges for the worker in planning in the community work context? Again, there's not right or wrong answers to these questions. I just encourage you to, perhaps through your reading and talking with fellow students or listening to these seminars, write down for yourself what you think might be happening in good planning. In the humanitarian context, it's often outside agencies that come to do community work. The community, a location or a particular issue perhaps is selected to work with. Often the location or the community has been selected because of an assessment of need. Someone has identified a particular location, and often it might be government or a humanitarian agency. In many cases, a location is actually being selected because of an emergency, such as a famine, a war, an environmental issue or catastrophe. An emergency or disaster planning is required in response to that. One of the critical things is that for emergency community work to be effective and to be carried out in a coherent way, there needs to be a plan in place prior to a disaster. However, what often is the case, and particularly in cases where there are limited resources, and also in areas where there are constant natural disasters, the preparedness of a particular community in response to that is going to be influenced by whether or not there is a plan in place, and often there may not be a plan in place. I'm looking now at slide 22. So prior to emergency planning, there should be, in the early stages and immediately after an emergency, planning that involves as many stakeholders as possible, and that planning is accessible and comprehensive. One of the things that often occurs at this point in disaster management is that community members, the people affected by the particular disaster or issue, are not always those who are consulted right at the outset. Post-planning is also required. And it's much easier if there is already in existence a plan. If not, what often occurs is decisions are made in a top-down way and don't involve locals. And it can seem necessary in an emergency situation that people are under pressure, that there's needs to get food and water and shelter really quickly to large communities and large numbers of people. However, a lack of consultation with local people can often lead to a longer term resentment and trauma, and can have implications later on. Some of the factors that need to be considered in being prepared is that there needs to be access to good data. There needs to be knowledge about where people are living. So we were speaking earlier about census data, for example. What are the facts and figures about where people are living, about the type of dwellings people have, about the state of roads, about the numbers of people living in each house? What are the houses made of? That sort of information is going to be crucial in terms of monitoring risk reduction. So building awareness, having plans in place prior to a disaster, building that awareness so that people, community members, already have an understanding or an idea about what do we actually do in this particular situation. There were severe bushfires in Victoria in 2009, and as a result of that, the fire authorities, the emergency authorities in Victoria have developed a much better plan in response to that disaster. People can have apps on their phone that give them updates about fires and the location of fires. For example, over the summer period, that's the sort of awareness that community members will benefit from. Identifying who the high-risk populations are is really important because they require different resources and different assistance. People who don't have mobility, older people, young children, people with disabilities. Linking all those stages to the community development, connecting that information and sharing it with people in the community is crucial. And the planning process involves every element of what we have actually been speaking about. And it also involves, in certain situations, having simulations that people know what will happen in that particular disaster. In terms of responding to a situation, the knowledge and the awareness of local government, so the government, the local town or the city government involvement of their role is pivotal in this. The coordination and conversation, communication between all parties is so important. There needs to be a logistician cadre who has that information, who knows the facts and figures, the location of all the resources, knows where people are living, and implementation of plan protocols. The reporting across agencies and sharing of information benefits everybody in these responses. After an emergency, there needs to be, the other part of this plan is that there's an adjusted recovery community development and resilience plan that people living in the aftermath of an environmental disaster have ongoing needs, and they will go on for many years. So having a plan that works with people around assisting them to adapt, to develop, to rebuild, to access resources, to access healthcare, and to involve them at every level in that process is crucial. And reviewing that plan, how did we go? We were speaking earlier about evaluation. Going back and reviewing that plan about its effectiveness is a critical part. One of the key criticisms that is often talked about in terms of emergency response and emergency community work is where international agencies, aid organisations arrive in a place and offer services, offer support, which we would call top-down emergency response, and that without the connection to community and local resources and local community members, this can actually be quite damaging. As the emergency aspect lessens, then the move into this recovery stage of work needs a significant amount of resources and significant amount of skill and planning as well for that whole follow-up phase. I'm going to encourage you to have a look at the film that is on our LearnLine site about asset-based community development in the Philippines. And in looking at this film, particularly about a church agency that has a role in a project in a really poor area in the Philippines, I want you to think about a few of these questions that we've been talking about. Is it possible for planning to be done well? And look at also how can planning be a tool for community workers and for humanitarian workers to use. And what I want you to also notice is how the planning process worked in this particular location. And it may be something that you want to jot notes down about, or maybe you want to discuss with fellow students. Thank you.